Stroke Investigative Research and Educational Network says every minute 6 indigenous Africans develop new strokes. The grim statistic is unfolding in a century in which improvements in the acute stroke care are unparalleled compared with any time in the modern history. In sub-Saharan Africa, up to 40% of patients die within 30 days of stroke, and 84% are dead within 3 years of a stroke diagnosis. On the average, stroke affects an indigenous African approximately 15 years younger than comparator populations in the high-income countries. For a medical disorder with well-established modifiable risk factors and effective treatment modalities, the high rate of post-stroke mortality on African continent are unacceptable. The poor outcomes of stroke in Africa are due to several factors, including inadequate health infrastructure, non-existent care pathways, and a shortage of neurologists to coordinate stroke care, and a lack of awareness of stroke symptoms. So curiosity has driven us to the Holy Family Hospital, where we spoke to a neurologist, a specialized neurologist, Dr. Na Oboshi, who gave us details on that.
Of ways you can have a stroke. The most important risk factor or the most important cause we have found out is hypertension. That's high blood pressure. That's the most significant and most important risk factor. It has been found that black people, people of African descent, like us Ghanaians, the exact cause is not known, but it has been found that we tend to have hypertension earlier on in life as compared to the white people, as compared to the Caucasians, the Asians, the Hispanics. And aside from us getting hypertension earlier, we tend to get more severe complications. So hypertension technically it does not give symptoms. If it is giving you symptoms, most likely a complication has already occurred. So it has a nickname called the silent killer. So you can be walking around looking very nice and your blood pressure can be very elevated and you won't have any symptoms. To prevent hypertension, let's say that we are genetically predisposed to it. So if we live long enough, most people of African descent, if we live long enough, at some point in your life, you have hypertension. You can delay the onset by some lifestyle measures. And in fact, the best thing is to detect it early. So I advise my patients, I advise the general public that after the age of 20, at least every year or every 2 years, just once in a while, walk to the hospital nearby you and then check your blood pressure. Aside from that, there are some lifestyle measures that you can put in place to prevent getting hypertension. For example, Africans are known to take in a lot of salty food. So we take in salt, we take in Kobe, we take in all these fishes that have been preserved with fish salt. Together we take Maggi, which has not Maggi per se, Maggi and its likes. So they have monosodium in it. So if we can cut down our salt intake, cut down our foods that have been preserved with salt, that will help us. Another thing we can do is exercise. Exercise has been shown to reduce our blood pressure. So at least 3 times a week, at least 5 times a week, 30 minutes of moderate intensity exercise. Something to get your heart pounding, something to get you sweating a bit. That's good enough. And aside from that, we eat food that is low in fat. If the person smokes, it's advised that the person stop smoking. Alcohol too has been found to be a risk factor. So it's preferred that we stop it altogether. But the minimum is 1 drink for a woman and then 2 drinks. When we talk about drinks, it's in units. So let's say 1 beer for a man, and then 1 beer for a man, the normal one, and then for the women we take half. What is allowed for women is half that of what men can take. a doctor to patient ratio, to begin with, is not good. There are too few doctors for the population. Aside from that, after you become a doctor, it takes you another 6 years for you to become a neurologist. So let's say after secondary school, you need about 12 years of studying to become a neurologist. Yes, it takes a lot of time. The other issue is once you become a doctor, you are expected to serve in the district for some years before you can start residency for the first 3 years. It is after that first 3 years that you go another 3 years to become a neurologist. And at each point, it is expected you come back and serve for a period of time before you start your program. But in advanced countries, once you finish medical school, you immediately start specializing. So it's a continuous 12 years. But for us, it is after the medical school 6 years. You have to do your housemanship 2 years. Then you are expected to work as a medical officer 3 years, 2 to 3 years, before you start the residency. After the residency, you are expected to do at least 1 year before you go back and then do the final stage before you can come as a neurologist. So there are a lot of breaks in between. But if it was a continuous process, I know that we would have more people, because people get tired. You get older, you start having children, and it's not as easy to be so focused to climb higher. The government has to make a sacrifice. If we want better healthcare for the citizens, you have to sacrifice and make the process smoother, so that and more advantageous for us, because there are other avenues you can pass through and then still be working as a doctor and earn more. But with these breaks, I somehow understand the government. For instance, our area like this, we have even fewer doctors to patients. So they would want people to come and serve for some time before going to school. But if they made it more attractive, follow through, set up more areas for teaching, other areas for teaching hospitals, we can increase the numbers in a shorter amount of time, and then the citizens can get better health care.